Anyone 16 years and older can now get the COVID-19 vaccine anywhere in the U.S. Some young adults, though, haven't rolled up their sleeves just yet. In today's To Your Wellbeing segment, we're addressing some of the common misconceptions that young people may have about the COVID-19 vaccine. Dr. Zoe Stallings joins us from now until 6 o'clock. All right, so let's get right to myth number one, and that is young people just don't even need to get the vaccine because they're probably immune to COVID-19 anyway.
Not the case. In fact, in clinic, I often see young people who are getting their second infection. And I emphasize always, we don't have any evidence to say that young people do not get this disease. In fact, we have seen young people get this, and the proof is in the numbers. We see that young people get infected, and we see that young people can spread the infection. So it's extremely important that we understand that your vaccination is not just about you and your health, it's for those around you as well. And since I'm seeing 20-year-olds who are calling me for virtual visits for their second infection with COVID, we know that it's true. So please get your vaccine. A lot of young people are saying to me, since it won't kill me, because that's the thought, it won't kill me, I'm gonna wait. That's not what we're trying to say. We need 70% of our population to be vaccinated so that we can all benefit and move ourselves out of this pandemic. Without the assistance of young people, we are still going to lag behind because they can continue to spread and they can die. Many parents have had this sense of fear. How do I get my young 20-year-old to take this seriously? And I'm concerned as well. I want to see my young patients getting vaccinated. I got my vaccine January 7th. I use myself as evidence that you will be okay. I consider myself to be fairly young. And the age is 16 and older. So please, for the young people listening, get your vaccine, not this wait and see approach.
All right, so myth number two is if older people are the ones getting vaccinated, then hey, I don't have to get vaccinated.
And that, once again, we have to make sure that we are protecting those around us, and also that it's an entire movement of the population. We need to get 70% vaccinated. Oftentimes young people say to me, well, if I'm not going to die from it, I don't need the vaccine. And I heard that the vaccine can kill you, and that is not the case. What we are trying to tell young people to understand is there are long-standing effects from this disease. I have seen patients who have had memory loss, something called COVID toes, in which your toes become swollen and look like there's a big blister, and it's not from an infection. I've seen patients who've had issues where they just don't go back to breathing normally. They have long-term shortness of breath. And as a young person, we really don't know what's going to happen to you in 10 years. So what we're saying is protect yourself from the disease. The vaccine, the numbers are good. We are seeing that we are able to keep people from having some of the most severe manifestations of COVID-19. So the risk is greater for you to get the disease. You will have worse outcomes. Let's go ahead and get vaccinated and have this let's try to get back to normal if we can.
All right, so this is a main concern and a very big myth that we're hearing all over the place, especially for women of childbearing age, that the COVID-19 vaccine could cause infertility.
And that has been discussed by the American College of OB/GYN. We are seeing that the American College of Gynecology is saying and advising that pregnant patients should get vaccinated. Reproductive age women should be vaccinated. The CDC has not released any statements suggesting that. And there's no data to support that. In fact, in many of the early trials, patients or subjects who were in the trials got pregnant during the trial. So we actually have data on pregnant women, and we see that their babies were fine. They did not have any issues with infertility. And I'm not sure where that myth started, but it spread like wildfire. And it's so difficult to break these myths once they get out and become urban legends. But I can tell you today, there's no evidence to suggest that. And during the trial, women got pregnant. They became pregnant, which means they weren't infertile, and had healthy babies. And OB/GYNs, they are giving the vaccine to their pregnant patients. It is safe.
Okay. So then myth number four is something that you hear with the flu shot as well, and it seemed to have carried over to the COVID vaccine, that you can get COVID-19 from the vaccine.
And I feel as though the word vaccine makes people think that we're giving you a disease. We're not giving you a disease. We're essentially priming your body so that your body has the memory of some component of this disease, so that next time it encounters it, your body is more efficient to fight it. So it's not that we're giving you the disease. In fact, many times this virus, that the portion that is injected into your body is very similar to the common cold. They've packaged it in such a smart way that our bodies can detect components of it without giving you the whole virus. And it's not even given to you in a viral form. Our body has to then make proteins, and it's a complicated pathway. But the simplest way I can think of it is it's a photocopy, and then your body takes that picture and remembers it for later. So I want you to understand, when you see a photocopy of a picture, you're not seeing the real car, you saw a picture of a car, but you remember what a car looks like. That's how the vaccines work. We want you to understand too, I'm a healthcare provider, I'm a mother, and I will tell you, when I saw how many healthcare workers were getting this vaccine, it reassured me, because there's no system in which we kill off our healthcare workers. We just don't do that. The vaccine was first given to our seniors who are most at risk and healthcare workers, because we were in contact with some of those very seniors and the most vulnerable. And the numbers coming back are showing that our healthcare workers have been truly protected. So the idea that you're given the vaccine as a disease is one that we have to break that myth.
All right, last myth here. The vaccine might be expensive, or you might need your health insurance to get it.
Not so. In fact, we are beginning to do vaccination drives through churches and through community centers, where people are not going in there with their insurance information. They're beginning to do these at the health department. At no point is cost going to limit you from getting access to this vaccine. And that's the thing is, when we're talking about the entire population, we're in a global pandemic. This is not a situation in which anyone's trying to make money. So it's really important that you understand it's regardless of ability to pay. It's through the county, and it's dispensed also through the help of the federal government. It's not about your insurance or lack thereof.
The vaccine is free. All right, so Dr. Stallings is going to be here answering your questions coming up in the next segment. How do you get your questions to Dr. Stallings? Well, you text us that question. That number is 336-379-5775. We'll be right back.